Welcome, everyone. I'm Elizabeth Shogren with Reveal from the Center for Investigative Reporting. I'm the moderator today, and we'll be joined by several speakers. Kyla Bennett, the Science Policy Director at PIRG, the Public Employees for Environmental Responsibility. Liz Moran, the Environmental Policy Director at PIRG. Richard Denison, the Lead Senior Scientist at Environmental Defense Fund. Tim Whitehouse, the Executive Director from PIRG. They will each give speeches and there will be time to ask questions between their speeches. I will be the one asking questions, but you can submit your questions to the Q&A and I will include your questions in there in that section. And then there will be a Q&A session at the end of the speeches. So with no further ado, I'd like to start off with Kyla Bennett.
Thank you so much, Elizabeth. I appreciate it. And just so everybody knows, this presentation will be available on PIRG's website, which is pir.org, and also our YouTube channel in case you want to watch it again or if you miss it. So today we are going to talk to you about toxic chemicals, whistleblowers, and the need for reform at EPA. And what we're hoping to do is to answer the question for you, how broken is EPA's Toxic Substances Control Act? Spoiler alert, it's pretty broken. Next slide, please. So for those of you who don't know TSCA intimately, TSCA is the law that was enacted in 1976 that addresses the production, importation, and use and disposal of specific chemicals. And some chemicals are not regulated by TSCA. Those include pesticides, drugs, tobacco products, food, and cosmetics. So TSCA didn't work very well. And in 2016, an amendment was passed. And this law was called the Lautenberg Chemical Safety Act of 2016. And the changes in that act were supposed to make TSCA more protective of human health and the environment. It mandated that EPA make risk-based affirmative findings on the safety of all new chemicals that were going to enter the market. This law also supposedly was going to increase transparency of what EPA was doing when it was doing these risk assessments on chemicals. And it also required EPA to make determinations on claims of confidentiality. So basically, when manufacturers bring a new chemical to EPA to do this risk assessment, sometimes they claim that it's confidential business information or CBI, and they keep from the public all sorts of information, including things like where the factory is or what the chemical is supposed to be doing, sometimes even information about the formula itself. Next slide, please. So the way TSCA works is that EPA has a division called the New Chemicals Division, where all new chemicals come in for review. And Section 5 of TSCA requires a manufacturer or importer of a new chemical to give EPA 90 days. So they submit something called a pre-manufacturer notice or a PMN. And this 90 days it has to go in 90 days before the manufacturer, importation, or use of such chemical. And so therefore, EPA has to review these PMNs and identify any conditions that need to be placed on this new chemical, up to and including an outright ban on the production of the chemical before it is entered into commerce. So this is how they're supposed to protect us. They do these risk assessments on these chemicals in this 90-day time frame to ensure that it is safe to go into commerce. Next slide, please. This means that the risk assessors only have 90 days to determine risks to human health and the environment. And EPA itself calls the risk assessors in the New Chemical Division the gatekeepers. These are the people who stand between the American public and these new chemicals. Next slide, please. So how can they assess risk in 90 days? The bottom line answer is that often they cannot. And for some chemicals, there is very limited information. PIRG was contacted by 4 employees who had worked or continue to work in EPA's new chemical division. These whistleblowers came forward with some startling information about how this division operates at EPA. They told us that for some chemicals, they have to do complete risk assessments based on nothing more than the name of a chemical and an abstract, so one paragraph of an industry study. Oftentimes when people think about EPA, they think about people in white coats with flasks in labs doing all this research. But that's not the way it works with new chemicals. What happens is these risk assessors are totally doing like desk audits. They get the name of a chemical, they get some very limited information, and they have to figure out if this chemical is going to cause an unreasonable risk to Americans or to the environment based on this information. They don't do the studies themselves. They are relying on industry-produced studies. Oftentimes, they can't figure out whether there's toxicity information on a particular chemical, particularly in the new chemicals division. So what they do is they look for analogs, chemicals that are very similar structurally to the chemical that they're looking at. And they try to develop toxicity information based on those analogs. Now, if they don't have enough information to do this risk assessment in 90 days, TSCA does give EPA the authority to reset that clock when the PMN is incomplete, if there's not enough information. The problem is, according to our whistleblowers, that EPA doesn't let them do that. And in fact, EPA employees are rewarded for getting cases out quickly within that 90 days. They are given incredible pressure to get them out in 90 days, even in the face of insufficient or incomplete information. Next slide, please. So our whistleblowers revealed that EPA, at least the Office of New Chemicals, is captured by industry. And I have a picture here of a media story that happened under the Trump years. It was very clear under the Trump administration that this was happening repeatedly. This particular article is on formaldehyde. Sources said that EPA blocked warnings on a cancer-causing chemical. And as much as people want to blame this on Trump, it was not just Trump. Next slide, please. This type of capture, industry capture of EPA happened under Obama. It happened under Bush. It happened under Clinton. It happened under most presidents, most administrations, bipartisan issue. It's a bipartisan problem. It wasn't just Trump, and our fear is that it's continuing to happen today. Part of the issue is that it's not just the political appointees that are making problems at EPA. It's managers that are in there as career employees. Next slide, please. So what is EPA's New Chemicals Division doing that's so wrong? This is what our whistleblowers told us. Next slide. They told us that managers and other people within EPA are deleting the risk assessor's language that identify potential adverse effects, including developmental toxicity, neurotoxicity, mutagenicity, and even carcinogenicity. Next slide. They also told us that their risk assessments were majorly revised. They were altered. The conclusions were altered to indicate that there were no toxicity concerns, despite data to the contrary, or despite the absence of data. Next slide, please. Finally, when our whistleblowers and others refused to sign off on these risk assessments that delete these hazards, when they refused to do it, the risk assessments were taken away from them and reassigned to more inexperienced employees in order to secure their agreement to remove these hazards. So in other words, human health and the environment is simply not being protected. People believe that the government is keeping us safe, that EPA is keeping us safe, and it is not. Just because a chemical is deemed safe by the New Chemicals Division does not mean it is safe. Next slide, please. So what is the solution? PIRG filed an IG complaint and also a congressional disclosure with these 4 employees. And we asked the IG to identify those risk assessments that were altered without the knowledge or consent of the risk assessor and correct them. We asked them to evaluate the processes that occur in EPA, the quality control process that allows these improper changes to be made and remain uncorrected. And most importantly, I think, we ask them to name names and ensure accountability. We know this is not just political appointees. These are career people who are at EPA who have been captured by industry, and we need them to be exposed and we need them to be gone. Thank you.
Thanks so much for those comments. I wondered if I could follow up a little bit with some questions. First, I'm really curious to know, what did the whistleblowers tell you about why they were coming forward together? Was there a decision made for this to be for this to be just the four of them, or were there more people coming forward?
That's a good question, Elizabeth. And there are more people coming forward now that these four have made this disclosure. You know, being a whistleblower is not fun. I was one myself at EPA many years ago. You know, people think of whistleblowers as, you know, whiny people who aren't getting their way. And that's the farthest thing from the truth. Our four whistleblowers were having trouble sleeping at night. They were horrified that they might be the reason that there were some chemicals. One of them said, I don't want to be the reason for the next PFOA to be out on the market killing people. I cannot sleep at night knowing what I know. So these four people started talking amongst themselves and figured out that they wanted to come forward, and they felt comfortable coming forward in numbers. But it is very unusual. I've been working at PIRG for 20 years, and this is the first time that I had so many employees come forward on one issue. And these are not the only four. There are other employees coming forward now, but I think they felt comfortable knowing that they were not alone in their fears and concerns. I think you're on mute, Elizabeth.
Kyla, is there any way for there to be a review of these decisions that have been made? I guess what you're saying is that these chemicals, quite a number of them, are now out there potentially exposing us to dangers that were deleted from the reviews. And I just wonder, you know, is this, is there any chance to reconsider these decisions?
Well, the Biden administration has pulled a few assessments already. They pulled one for dicamba, which is a pesticide. They pulled one for TCE, and they pulled one for a PFAS, PFBS, to reassess them. So it's not an easy thing to do. And so it's not going to be something that's, there's no quick and easy solution to this, but we feel that it's necessary that these chemicals be reassessed, and that the IG do a comprehensive look to see how many chemicals this happened to and figure out what they can do to right these wrongs. Because these chemicals are out, as you point out, they're out in commerce now, being used by people. They're harming workers in factories, and they might even be harming the American public. So it's not an easy thing to do, but it's a necessary step.
Thank you very much for your comments. I really appreciate it. And I think maybe we will move on now to Liz Moran. Liz, the floor is yours.
Thanks so much. Hi, everyone. It's a pleasure to speak with you today. My name is Liz Moran, and I'm the Environmental Policy Director with NYPIRG, the New York Public Interest Research Group. We're a statewide advocacy organization, and one of our principal areas of concern is protecting the environment. We believe all New Yorkers, and frankly, of course, all Americans, should have the right to clean and safe drinking water. So as Kyla mentioned, the public has this basic right and expectation that government is providing them safe and clean drinking water. But unfortunately, there are a number of threats to that very basic right. A principal one being the very flawed way chemicals are regulated in our country. And the picture of our country's flawed approach to chemical regulations is very clear. It's visible in the news stories that we're seeing more and more of every day, of drinking water contamination crises. It's visible in the outspoken members of these communities who are facing negative health consequences as a result. And it's very visible when you look at the story of a small community in New York, Hoosick Falls, New York. Next slide, please. Sorry, next slide. Thank you. So for those of you who aren't familiar with Hoosick Falls, New York, it is a small community, about 3,300 residents, working class, about an hour away from the state capital of Albany, on the border of New York and Vermont. They ended up in a nightmare situation that no one wants to face. One day they got a letter from EPA informing them that very high levels of the chemical PFOA was in their drinking water, and that their drinking water was unsafe to drink. So residents are learning that this chemical they can't see, they can't smell, they can't taste, has been polluting their drinking water potentially over the course of decades, and is now in their blood and could very well be the reason why so many people are sick. So you'll see to the left an image of two children from Hoosick Falls. PFOA is so predominantly used, has been so predominantly used, that almost every American has some level of PFOA in their blood. It's been estimated that level is about 2 parts per billion. When residents in Hoosick Falls started having their blood tested, they found extremely high levels of PFOA in their drinking water. As you can see, these two children had levels far higher than 2 parts per billion in their blood. And they found extremely high levels of the chemical PFOA in Hoosick Falls. The landfill in Hoosick Falls had levels as high as 40,000 parts per trillion. So this was absolutely devastating and highlights a number of issues with how this country, frankly, doesn't regulate chemicals that can have very detrimental health impacts. One example here is the fact that PFOA wasn't found in Hoosick Falls drinking water because of federally mandated testing. Hoosick Falls is a small community, so they slipped under the radar for some federal emerging contaminant testing. It actually took a resident in that community who knew that PFOA was used by the company in town. His father got sick and he was suspicious. So he had the water tested, and that's how PFOA was found. This is a nightmare situation that should not be replicated anywhere in New York State or across the country. But unfortunately, it has been, and we know this thanks to EPA drinking water data. Next slide, please. Next slide. Thank you. So in 2019, NIPIRG released a report called What's in My Water, where we analyzed EPA's UCMR, that's the Unregulated Contaminant Monitoring Rule data. This is a list of unregulated contaminants that EPA has identified as a potential threat to public health and drinking water. They come up with these lists every few years. PFOA and 1,4-dioxane, another emerging contaminant, were identified on this list. And as you can see through this data, a number of emerging contaminants were detected across New York State. Long Island in particular had some of the most frequent detections of emerging contaminants. And I should note these communities, this is a limited sample. The communities that had to test at this time for emerging contaminants had 10,000 or more residents. Next slide, please. So our key findings, nearly 16 million New Yorkers rely upon water systems that detected 1 or more UCMR3 contaminants. And then again, we found Long Island has by far the most detections of emerging contaminants found in drinking water. Long Island is a really important community to look at because their drinking water is particularly vulnerable. Long Island is quite literally a sandbar. Their soil is extremely permeable, and Long Islanders rely upon a sole source aquifer. So this aquifer can be readily jeopardized by poorly regulated contaminants, and it has been. As you can see here, strontium was detected very frequently, chromium-6, chlorate, chromium, and 1,4-dioxane, and there have been a number of PFAS detections on Long Island as well. Next slide, please. One of the most famous polluted sites on Long Island is the former Grumman site, otherwise known as the Grumman Plume. This is a huge pollution radius along Bethpage on Long Island. And as you can see, 1,4-dioxane is actually found in Bethpage because of this site as well. Grumman used 1,4-dioxane came from the solvent stabilizer that was being used at Grumman. Other pollutants from the Grumman site include TCE and radium, and that's just a few. But because of how poorly regulated these chemicals have been, there have been literally millions of New Yorkers who have had their water jeopardized. So there's something in common. While Long Island is very different than Hoosick Falls, these communities all have the same thing in common, and they all are asking the same questions. Next slide, please. They want to know why this was able to get in their drinking water to begin with. And they know very simply, if a chemical can cause harm to their health, it shouldn't be used in products. It shouldn't be found in drinking water to begin with. So as a result of these groups, these communities getting together, New York State has made some important changes, but we know this needs to happen on the national stage. We have drinking water standards for a few of these chemicals now. We've banned PFAS chemicals as a class in firefighting foam and in food container products, and we have a ban on 1,4-dioxane in products. But this has to be just the start, and we know this needs to come from the federal stage. It would be far cheaper for their health and for cleanup processes if we just regulated these chemicals from the outset.
Liz, thank you so much for your comments. I really appreciate it. I wondered, you know, once you did a few years ago identify these levels of emerging contaminants, did something happen as far as drinking water getting cleaned up? I know several of those chemicals can be treated in water systems, like 1,4-dioxane.
Yes, the state is currently undergoing a number of processes in various communities to clean up and treat for these chemicals. PFAS chemicals can be treated through granulated activated carbon filtration systems. So there are a number of communities like Hoosick Falls and Newburgh, New York, that have these systems in place. 1,4-dioxane is a little bit more difficult to treat, but there are different treatment technologies available that are being explored on Long Island. Oh, you're muted again.
You say that you're looking to the federal government for help on this, and what is it that you want?
Well, one example is New York State did establish drinking water standards for PFAS for PFOA and PFOS and 1,4-dioxane. That should happen on the national stage. But I think what is most important to come from the federal government is preventing these chemicals from being used in products to begin with. As you can see, the policies that have been adopted in New York, while important, have come after the fact, after people have already gotten sick. We want to prevent people from getting sick to begin with. Which is why the whistleblowers, what they've raised is so important, because they are supposed to be that stopgap. They are that first step in the process to prevent potentially dangerous chemicals from being used on the market.
Thank you very much. And next, we're going to turn to Richard Denison.
Thank you, Elizabeth. I have long described the EPA New Chemicals Program as a black box. For decades, it has operated almost entirely out of public view in multiple ways. Excessive confidentiality claims and the withholding of information from the public have been standard operating procedures. A purely bilateral mode of operating developed in the program where the only parties in the room are EPA and the chemical industry. The inability of the public to access information and meaningfully participate has severely limited public input and scrutiny. As a result, a highly insular, almost secretive program culture has arisen over time, one where EPA has often viewed its only stakeholders to be the companies that are seeking quick approval of their new chemicals. In some, private interests have trumped public ones. Now, the 2016 amendments to TSCA that Kyla mentioned did significantly overhaul the new chemicals provisions of what at the time was a 40-year-old law. And it sought to rebalance the interests to some extent. For the first time, EPA is required to actually review each new chemical and make a safety finding and to explain the basis for its finding. The lack of sufficient information in and of itself is a grounds for EPA to restrict a chemical or require testing. Before, unless EPA had enough data to show potential risk, it simply dropped the chemical from further review and it went onto the market. Companies' ability to simply assert their submissions are confidential has also been reined in a number of ways. Now, to be sure, the amendments did not address all of the problems. For example, despite the fact that the vast majority of new chemicals lack basic safety data, requiring companies to provide a minimum set of information, as many other countries do for new chemicals, was a bridge too far in the face of massive industry opposition. The revelations we've heard about today indicate this is still a big problem. Despite TSCA's mandate that EPA restrict or require testing of chemicals lacking sufficient information, that has not been happening. EPA still excessively relies on estimating a new chemical's potential risks using models and extrapolations of data from other chemicals. Approaches that have serious limitations introduce large uncertainties and are themselves often a black box. Immediately after the 2016 reforms, there were signs that EPA was starting down a better path. But under the last administration, that progress was quickly reversed and the worst features of the pre-reform program came roaring back. Indeed, the program has ended up worse than it was before TSCA reform. And the new revelations vividly show that. They show how far we have to go and the culture that needs to change. What strikes me about the whistleblowers' allegations is that they all cut in industry's favor, removing or downplaying risks that the scientists had flagged. This argues that the problem is not just a case of scientific disagreements, but points to a systemic problem. Now, I want to share with you at the macro level just what has been happening over the recent years when these decisions have been being made. In 2017, Scott Pruitt, the administrator at the time, responded to an all-out pressure campaign from the chemical industry and announced sweeping changes to be made to new chemical reviews. These deviated from TSCA's requirements, and they hit the ground in mid-2018. So if I could go to the first slide. I'll wait a second for that to come up. There we go. If you could put it into there, perfect, thank you. Since those changes were put into place, almost all new chemicals have been approved without condition. Nearly 3/4 of the chemicals EPA reviewed since then were granted unfettered market access, no conditions imposed. And testing requirements that had been being implemented in those first months after reform have entirely disappeared, despite the fact that the chemicals still have almost no health or environmental data. In the next slide, I'll show you a little bit more just how dramatic a shift occurred. There are two main outcomes of a new chemical review. One results in a consent order in which EPA imposes conditions if it finds potential risk. The other is that EPA finds a chemical is not likely to present unreasonable risk, in which case the company can make the chemical without any conditions. So on the next slide, let's look at the frequency of those two types of outcomes. This chart tracks EPA's own statistics from May of 2017, when they first began to report these numbers, through June of this year. And you can see this clear inflection point when the new policies came in 2018, in the summer. The issuance of orders flattened out, not likely determinations soared. And that was the inverse of what had happened just prior to that. Let's zoom in the next slide to the period after those policy changes took place. And you can see here that nearly 3/4 of all the chemicals reviewed got their not likely determinations, allowing them onto the market without condition. The next slide, I want to raise a second point, which was an effort by EPA under the last administration to dismiss worker risks, no matter how large. And this was in response to an industry demand that they wanted EPA out of workplaces, despite the fact that TSCA mandates that EPA must ensure the protection of workers from chemical risks. For nearly 80% of the green lighted chemicals, EPA actually identified some risks to workers, but then dismissed it by falsely assuming that that workers would simply wear personal protective equipment to protect themselves. In fact, of the 80 most recent cases we examined, more than half of them found risks to workers that exceeded EPA's own acceptable risk level, and not just by a little bit. Skin exposure, dermal risk was 15 times on average higher than the acceptable level EPA used, and inhalation risks 4 times higher. So let me finally turn to what fundamental changes I think are needed here. Unfortunately, the changes in those trends that we would like to see are not yet apparent. EPA has announced its intent to reverse some of the most damaging of those earlier policies, and we are very welcoming of that. But EPA's practice also needs to change. And as I said earlier, what the whistleblowers are revealing is what happens when a program operates out of public view. So this slide tells you a few things that I think need to happen. EPA needs to again provide the public with its scientists' initial recommended decision on each new chemical. EPA had done that for decades, but abruptly stopped doing it in January of 2018 in a move that I characterized as hiding its tracks. The public has a right to know if EPA scientists flag concerns based on a company's new chemical notice. If further information or the imposition of conditions can address that concern, then EPA can and should be clear about what changed. And restoring this simple, longstanding practice is vital to increasing the accountability of the review process. Second, the public needs to have timely access to all of the documents related to each new chemical, subject to redactions only of that information that is eligible for and meets all TSCA requirements for withholding it as confidential. These documents should include all new chemical notices and their attachments and revisions to those documents that are made during the review. All health and safety information on a chemical which is not eligible to be protected. All correspondence between EPA and a notice submitter. And finally, the reports that EPA itself generates during the review process to support its decision. Third, all versions of a new chemical assessment that EPA scientists perform need to be kept. And if there are changes made to those assessments, the basis for those needs to be documented and fully justified. A meaningful opportunity for the public to provide input into EPA decisions on new chemicals is essential here. It's critical to begin to dismantle this strictly bilateral, behind closed doors mode of operation of the program. And finally, a thorough investigation is needed of whether program managers used their positions to coerce agency scientists, override their assessments, or sideline or retaliate against them. And if that is the case, those managers should not be permitted to retain their positions of authority. Restoring scientific integrity requires holding accountable those who abused it. Thank you.
Richard, thank you for your comments. I wonder, one of the things that stood out to me is this idea that the industry gets to do its own tests of the chemicals, and that's basically the only testing that EPA can rely on for many of these chemicals that haven't been tested elsewhere. And I wonder, is that adequate?
It's a good question, Elizabeth. I would note that that's the way most chemical programs in the US and frankly in the world work. Pharmaceuticals are tested by their manufacturers and pesticides are too. So it's not unique to TSCA. And there are procedures in place to require the use of certain methods and documentation and quality control. Those procedures were put in place though because industry abused the system and many times cooked the books. So it's a dilemma because we don't have a government apparatus that is sufficiently funded and developed to be able to do all of this testing. But at the same time, it does require an enormous amount of scrutiny to make sure that the information EPA gets from the industry is reliable. And one way to do that is to shine sunshine on that information and make sure the public can access it and scrutinize it.
Why no stakeholders involved besides the industry? I was just working on a completely unrelated story, and in that case, the stakeholders were considered only industry and government, and nobody talked about the people who might be harmed by the pollution.
Yeah, it's a big problem. In fact, you know, what TSCA requires is that when EPA does find a concern about a new chemical, it is to issue an order that imposes conditions. Decades ago, EPA decided to make that order a consent order and to actually negotiate the terms of it with the submitter of that new chemical notice, with nobody else in the room. So that is the origin of this bilateral relationship. We and many others over the last couple of decades have been slowly trying to chip away at that secrecy and that closed system. Because, as Liz pointed out so well, it matters. These chemicals get out into the environment, they get into products, we're exposed to them, and we have a right as the public to have a role in this process. And
what about Congress? Is there a role for oversight of Congress in here?
Absolutely. You know, Congress, a number of members of Congress were very heavily involved in the reforms to TSCA, including the new chemical provisions. And we have certainly been in contact with members about the need for them to exercise their oversight. PIRG did share the allegations with folks on the Hill, and I think that's going to be they have a critical role to play in all of this.
Thank you, Richard. And Tim Whitehouse, I think you have a few comments to wrap us up before the Q&A.
Yes, thank you, Elizabeth. It's good to be here. There are a few things I wanted to emphasize that were said today and put some more weight behind them. The first is that we can't emphasize enough how broken EPA's chemicals program is. And a few months ago, we came across a survey that was done in the internal workforce at EPA, and it asked the different employees this question: I can disclose a suspected violation of any law, rule, or regulation without fear of reprisal. And the EPA-wide response to that was 20% said that they could that they would not fear reprisal if they disclosed a violation of law, rule, or regulation. In the risk assessment division, that number was 56.1%, and those figures are on our website, and we'll be happy to share them. So there's a huge level of fear in the toxics division, people that work on new risk assessments, that if they do report violations of law, rule, or regulation, there will be a consequence for their career. And we've seen this over and over in all of OPPTS, which is the Office of Pollution Prevention and Toxics, that where staff members, scientists raise issues of concern, they are retaliated against. They are moved out of their work into other divisions, or they are given assignments that do not reflect their scientific expertise. And these are top-ranked scientists with PhDs from some of the leading schools. And so think about that. What happens when people get their PhD in toxicology or chemistry or other professions where they want to work at EPA? They come there and they raise concerns, and then there's retaliation. So what's happening is the expertise within the government workforce, and particularly EPA, is being degraded and politics has taken over. So what I want to emphasize is that the system is so broken that it's going to take a sustained commitment by the new administrator and by the assistant administrator and by Congress to fix things. There aren't a few easy steps that can be taken. And we would encourage the administration to put the resources that are needed into this to fix this problem. And I think we've heard why. I think Liz Moran highlighted some of the problems in New York State when these chemicals get into the market and work their way into our drinking water, into our bodies, that we are literally destroying communities, we're destroying livelihoods, and we're imposing tremendous healthcare costs upon the American population if we don't properly assess the risk to these chemicals to begin with. And I'd also like to emphasize another category of people that are extremely at risk, and that is the workers. Workers in industry that are handling these chemicals, the agricultural industry. If they don't know the risks that they're undertaking by handling these chemicals and working with them, they can't mitigate those risks. And so, you know, as the administration looks at and evaluates the whistleblower complaints, we hope that they will do this in all seriousness and that Congress will provide the support they need to make sure EPA is properly able to assess the risks with these new chemicals that are coming onto the market. I'll also just emphasize a couple other things. One is each agency in the federal government has a scientific integrity policy. These policies do not work, period. They allow people that have scientific concerns to raise these issues in theory without fear of retaliation, but that has not happened. And so the administration is looking at these scientific integrity policies to improve them, but they'll continue to be paper tigers unless they have enforcement mechanisms in them and consequences for managers who violate these policies. Right now, there are none. And often what happens when scientists make complaints under these policies, they're then outed and identified as problem makers, and management that is managing these employees are actually involved in deciding whether there's been a violation of the scientific integrity policy. So far-reaching structural changes are needed in the policies that govern science in the federal government today. Those are my main comments. I do want to note that Friday is National Whistleblowers Appreciation Day. And throughout the course of the environmental movement, both in the private sector and government, whistleblowers have played such a huge and important role in exposing problems within industry and within the government. And these 4 whistleblowers that have stepped forward are part of a long line of patriots in our country, people that are concerned about the direction of the country, and at great personal risk step forward to expose problems. And it's our job to make sure that we push the government to devise solutions to protect us all. Thank you.
Thank you, Tim. I wanted to remind everybody on the call that if you have questions, you can submit them via the Q&A function at the bottom of the Zoom. And it'd be great to hear what your questions are. One of our participants said that, gave the suggestion that the testing of these chemicals should be done by a third-party unbiased research center instead of by the industry itself. Anybody want to field that question?
I can field that, Elizabeth. It's a great idea. Obviously, that would be, I think, the gold standard. That's what should happen. But realistically, it costs a lot of money to run these toxicity assessments, to do these studies. And where is that money going to come from? So, you know, even academic institutions, and when you look at some of these articles, I mean, let's take the PFAS industry, for example. PFAS is in the news everywhere. When you look at some of the studies, done by the industry itself. They show, I saw one article where that 3M did that said PFAS lowers cholesterol, so we can't trust the industry studies, but they're the ones paying for these studies, even at academic institutions oftentimes. So we would need a massive amount of money to have some unbiased group do this themselves. EPA theoretically could do it with ORD, their Office of Research and Development. I mean, they have some great scientists there. They've got great lab equipment, but again, it's a matter of money and time. And again, a lot of these chemicals are considered confidential business information. So these companies don't want to give the substance to a private lab or an academic institution or whatever to do work on it.
Let me add, if it's all right, Kyla, one other issue. I mean, I agree with what you said, and it's a difference between an ideal world and the one we live in. One critical thing, though, is to ensure that EPA and ultimately the public has the ability to detect and measure these chemicals, has analytic methods to be able to know how much of it is in the environment being released, to be able to monitor for it and the like. And there's a battle going on around that question about what obligations companies should have to provide methods to EPA to be able to monitor their own chemicals once they're in the environment.
And if I could just add to that, Richard, look at the instance of Solvay that actually sued a lab in Canada, I believe, because they were testing for one of their chemicals and they didn't want that test to be out there. So a study just recently came out about all the PFAS that they found on Cape Cod, Massachusetts. The vast majority of them were ones that they had never seen before. They don't know where they came from or even what they are, because these industries are holding this information so tightly.
One of our participants in the Q&A, you can read the details there, relays us an example how in the 1990s there were other examples of whistleblowers being retaliated against, and in even later, and this is nothing new. One of the things that I always wonder when these brave people stand up and shine a light on something that's wrong, that's happening inside our government, what could be done? What better protections could there be for whistleblowers so that they aren't, so that their bravery is not punished with careers that often get sidelined and sometimes destroyed?
Yeah, I'll take a shot at that. There are various proposals in Congress to strengthen whistleblower protections. There are a number of steps in the administrative process that should be available to expedite the protections available to whistleblowers. What often happens is when they make their disclosures, there are a number of ways they can make their disclosures, and they get bogged down in the system that takes many, many years to resolve. And so efforts to protect whistleblowers need to look at expediting the system, ensuring their anonymity, and most of all, I think what we're losing in the last few decades is congressional oversight of the agencies. Congressional oversight used to be a bipartisan concern, and it seems now we're slipping more and more into everything is about politics and gaining political advantage. So as a society and as a culture and as legislative institutions, we need to step back and make sure that Congress and we elect representatives that value government and that are able to hold federal agencies to account when they do retaliate against whistleblowers. So with National Whistleblower Appreciation Day on Friday, any of you that want more information on that can Google that or go to PIRG's website and learn about some of the reforms that are being proposed to help protect whistleblowers.
I'm still looking for more questions from our audience, but in the meantime, there was there was a section of Sharon Lerner's story that caught my attention, and I wondered if maybe Kyla could address this. It has to do with one of the 4 whistleblowers who's still working in the office that where these issues came up. Elise Osterwheel, she reported that the disputes over chemical assessments and retaliation have continued in that office. In Sharon's story, she says continued unabated. And I wondered if you can comment a little bit on that. I mean, I think that there was this idea that the Trump administration was very positively disposed towards the chemical industry, but to hear that those policies have continued, or that practice has continued well into the Biden administration, I think that I'd just like to know what exactly the information is, and if those other 3 were punished under this administration or only under the last administration.
So I'll take those in reverse order. The other 3 were moved out of New Chemicals Division under the previous administration, not under the Biden administration. So you're correct. Elise is the only one still in New Chemicals Division. She says it is continuing unabated. We have evidence of that. We are going to be doing another disclosure either this week or next week shortly on some of those issues. You know, these 4 whistleblowers have all been retaliated against, between being downgraded in their performance reviews, being told to work when they're sick, having cases taken away from them when they object to the removal of risks that they have found. They've been yelled at. They've been told they won't be defended. They've had things thrown at them. I mean, it's really a horrific situation that they're all in. And as far as the Biden administration goes, I am cautiously optimistic. I think that Michal Friedhoff, who is the assistant administrator for that office, has said all the right things. I'm hopeful that she will take our disclosures to heart and try to figure out how to make things better in this office. I think Michael Regan has said the right things. So, you know, here, Administrator Regan actually issued a memo several months ago about transparency and about how EPA scientists should be free to talk to the press, and how, you know, it was his fishbowl memo saying, we're going to be transparent. We're going to, science is back. Science is not yet back. I don't want to blame the Biden administration yet. I want to hold their feet to the fire, but I think they have inherited so much of a mess that they are making some strides in some areas, and they are trying to deal with these issues. But this is something that they need to tackle soon, and they need to tackle it quickly and with great strength, because this is something that is affecting every American, not just the workers, not just the susceptible populations, but these are potentially dangerous chemicals that are going out into commerce. And it needs to be put at the top of their priority list. So I am cautiously optimistic. I think the reason it's still occurring is that this industry capture has filtered down below the political appointees into mid-level managers. And that's what we have to address. That's what Michal Friedhoff and Administrator Regan have to address, is the fact that this culture at EPA is just wrong and needs to be changed. And they just haven't gotten there yet, but hopefully they will.
Kyla, could I just add one other thought there? I agree with what you just said. You know, there have been major hits taken by EPA to staff morale, and frankly, to the level of scientific expertise, which has dropped over the last number of years. So there's a lot of rebuilding that is needed. And The reason I think it's incumbent on the agency to take what is coming out seriously is it goes to the ability of the agency to rebuild itself in terms of morale of its staff and in terms of the scientific expertise that's necessary to implement this law and to carry out the mission of the agency. So it's actually a core additional reason on top of just the obvious ones for why EPA really needs to get ahead of this issue.
A couple of participants have raised the question of whether the right answer might be for staffers to just refuse to sign off on these assessments, since it takes so long to do these whistleblower investigations.
Yeah, that's exactly what they're doing. So our 4 clients have refused to sign off on some of these risk assessments, and they are taken away from them and given to either a less experienced staff member who will do what their managers are telling them to, or the managers themselves will alter these documents. So these risk assessors refusing to sign off is not going to solve the problem. That's what they tried to do first. We were really the last resort for these 4 scientists. They tried to deal with this internally. They tried to do things like not signing off on these risk assessments, but they were just given to someone else and finalized anyway. They tried to work through the scientific integrity process, which, as Tim pointed out, was a dead end. They couldn't get anywhere with that. They went to their managers, but their managers are the ones who are making these final decisions and getting these chemicals out into commerce without the proper risk assessments. So they were kind of caught between a rock and a hard place. So that, unfortunately, is not the answer for them.
One of the things that I wonder about is consequences, and I don't mean retaliation for the whistleblowers, but consequences for the government managers who have been, editing and punishing scientists when they do their work and try to protect the public. And that's something that I don't quite understand. It seems like that this mid-level government manager's job is to basically do the bidding of their bosses. And when their bosses change, they just are supposed to change their job and do the bidding of the new bosses, which might mean that they're overriding the decisions of their scientists in one administration and whatever in the next administration. And I just wonder, like, is that really the right way for those jobs to be structured, so that government managers' jobs are to ignore science when that's what the president wants, or embrace it if that's what the president wants? And if that's not the way their jobs should be framed, I feel like that is the way they're framed now from my reporting on issues in TSCA and elsewhere. And I just wonder what you think from your much greater knowledge.
I agree that it should not be that way. I mean, science is science. So that is definitely a problem. I think what's happening here is that industry really has a hold on this division, both pesticides and new chemicals. And, there's this incredible revolving door. There's one EPA employee that's been back and forth between industry and EPA 4 times in this area, in this division. So, these people are, I mean, we don't know why they're doing it, but it's not necessarily because the people above them, the political appointees above them, are telling them to do that. Certainly that did happen under the Trump administration, but that is not the only answer. That's not the only reason why they're doing it. And I don't know the answer to the question, why are they doing this? There is that revolving door. Some of them do get jobs in industry afterwards. That's pretty standard. In fact, Sharon Lerner found in her pesticide article that every single director of the Office of Pesticides at EPA, except for one, I think, has gone on to the pesticide industry after they left. So it's really hard to get a handle on that, Elizabeth. But you're right. It's not right to have that happen.
There is a question about pesticide risk assessments, but I feel like that will take us in a different direction. And I think it's time for us to wrap up. So if anybody has a last word, please jump in. And if not, thank you all for joining and participating.